Good afternoon. My name is Deborah Gannon, and today I will be doing my 2 areas for a person that has had a stroke. See, hi, my name is Deborah Gannon. I'm here today to help you and your loved one understand how to safely support feeding and mobility after a stroke. A stroke can affect how someone moves, swallows, and even how they sit or stand, but with the right care and knowledge, recovery is possible. Let's start with feeding. After a stroke, some people may have trouble swallowing. This is called dysphagia. It is very important to prevent choking and ensure you're getting the nutrition you need. Poor swallowing can lead to aspiration, where food and drinks enter the lungs, possibly causing aspiration pneumonia, which is a serious risk. Here are some feeding tips. Sit upright at 90-degree angle when eating or drinking. Stay upright for at least 30 minutes after eating. This reduces the risk of food or fluid entering the airway, supporting safe and effective swallowing. Take small bites and sips. Don't rush. This gives the person more control when swallowing and prevents choking. If recommended by your speech therapist, use thickened liquids to prevent choking. Thicker fluids move more slowly and easier to control during swallowing. Avoid talking while chewing. To reduce the risk of food getting down the wrong way, multitasking while eating increases the risk of aspiration. Watch for signs of swallowing trouble. Coughing, drooling, or a wet voice after eating. Early identification of these signs helps prevent serious complications like pneumonia. Here's some things to the caregiver. Always stay with your loved one during meals and watch closely for any signs of difficulty. If you're unsure, reach out to your care team. Let me ask, can you show me how you would sit during a meal? What would you do if a loved one starts coughing while eating? Now I'm going to be doing mobility after a stroke. After a stroke, many people have weaknesses on one side of the body. It's important to help the person move safely to avoid falls or injuries. Here are some mobility tips. Always use non-slip shoes or socks to prevent falls. Footwear with grip helps reduce the risk of slipping, a common cause of post-stroke injuries. When helping someone stand on their weaker side and support them. The weaker side needs more assistance. Standing on this side gives you better control and helps prevent falls. Use a gait belt if trained and always move slowly. A gait belt provides additional safety and control when assisting with transfers. Keep walking paths clear of rugs, cords, or clutters to prevent tripping. Environmental safety reduces the risk of home falls, a major cause of rehospitalization after a stroke. If a walker or cane is recommended, make sure it's always within reach. Consistent access to mobility aids supports independence and reduces fall risk. Encourage movement. As much as a doctor or physical therapist allows, even short walks help with recovery. Activity improves circulation, reduces stiffness, and helps retain muscles for balance and coordination. Here's a clinical example. For example, Mr. Smith, who had left-sided weakness after a stroke, needed help standing and walking. His caregiver learned to stand on his left side, use a gait belt, and clear clutter from the hallways with support. He was able to walk short distance daily, which helped improve his strength and confidence. Let's check your understanding. If your loved one has One's left-sided weaknesses. Which side would you stand on when helping them walk? That's correct. Can you show me how you would help them from a chair to a standing? You're absolutely right. You're doing a great job. Helping someone recover from a stroke takes time, patience, and care. Let's review the key points. Sit upright for safe eating. Watch for signs of swallowing problems. Move carefully and always support from the weaker side. If you're ever unsure, contact your nurse, therapist, or doctor. You're not alone. Your care team is here to help. Before we finish, do you have any questions about feeding or mobility? Can you tell me one thing you learned today? Thank you for taking the time to learn. With your help, your loved one has the best chance to recover safely and maintain quality of life at home. You take care, and thank you for listening.